This is Talk Business and Politics with Roby Brock.
And welcome to the show. I'm Roby Brock. Thank you so much for joining us. Well, 2022 promises to be a big year for Arkansas in business and in politics. We stick mostly with business this week as we start our State of the State Executive Roundtable. Dr. Joe Thompson, CEO of the Arkansas Center for Health Improvement, Shannon Newton, president of the Arkansas Trucking Association, and Sylvester Smith, Arkansas director for the National Federation of Independent Businesses, all sat down with me via Zoom to have a conversation about what they see in their crystal balls. Here's the first part of that interview. All right, Joe Thompson, I am coming to you first as you are at the center of the swirling disaster going on in Arkansas. As we tape, the coronavirus is raging in Arkansas. We've got some of our highest daily counts that we've ever had from the Omicron variant. At the same time, it does not seem to be making people as sick. Kind of assess the situation of where we are and what you see happening just in the short term, the next 2 weeks to 4 weeks.
Well, Roby, I think we're in the middle of an uncontrolled spread from a variant of this virus, COVID-19. The COVID-19 virus has the ability to mutate, and it can mutate, and one of three bad things can happen. It can become more infectious, it can become more deadly, or it could come out from under the protection that our vaccinations offer. The Omicron does a little bit of two of those. One, it is very much more infectious. One infected person now may be infecting as many as 15 more each day. So this is why we're seeing the dramatic spread. It does appear to be a little less deadly, but if you have more people with it, you're going to have potentially more hospitalizations and more death. And it does require that you have the booster shot to actually get the benefit of the vaccine. So we only have about 30% of our Kansans that have had the full first round and the booster shot. So a strong recommendation for everyone to go out and get the booster shot so that you're protected.
Let me ask you this. This probably gets into more medical theory, but I mean, there's obviously enough evidence to support or not support this. How do we get to the point of herd immunity, which is where we've been trying to get with this through the vaccine process? Can people getting sick from Omicron, but not affecting everybody as deadly as it did, can it help us get to where we eventually need to go with herd immunity?
If there is a positive, approach to this, it is that the spread of Omicron being so wide is that it's going to expose individuals to COVID-19. Their immune systems will become aware of what COVID-19 is, and then we will get to herd immunity more quickly. Unfortunately, individuals that either have comorbid conditions or whose immune system doesn't react may have bad outcomes, and these will be the family members and members of our community that we may lose more of. So it's a mixed blessing of having widespread infections. And of course, the wild card is always, does it mutate into a new version of the virus that our immune systems do not recognize?
Yeah, we'll watch for that. Obviously, we will not have that answer today. Shannon, I come to you next. Again, staying in this public health emergency that we've been in for the better part of 2 years, kind of give some folks a little bit of background of how it has impacted the trucking and the transportation industry. And is it responsible for some of the non-public health problems we see within the industry and the supply chain today?
Well, I think from the trucking industry's perspective, as it relates to the COVID-19 pandemic that we've all experienced over the last 18 months, the industry has actually had the opportunity to continue to do what it has always done, which is deliver goods to people, wherever they are. It has been increasingly challenging. We've also, of course, we have labor issues. But initially, if you think back, there were times at which we weren't sure how we were going to cross state lines or where the drivers were going to be able to use facilities. And so those types of challenges, just that are unique to our industry, were certainly ones that had a very hampering impact initially and contributed to some of the supply chain issues and supply chain concern that that everyone was more familiar with throughout 2021.
I'm not sure if the industry is living right or not, but in the midst of all of that, you had one of the most major thoroughfares from east-west corridor kind of get shut down for several months with the Memphis Bridge there. That kind of compounded some problems for you, didn't it? So
Certainly at a regional level, that was a major story of the last year, having that. As you mentioned, a major corridor for interstate freight being shut down for approximately 3 months had a significant impact on freight flow across the country, but particularly those companies that were in Arkansas and those that relied on the bridge, in some cases more than once a day. The impact there was particularly painful.
Sylvester, you represent a lot of different business interests, but I want to particularly focus on small businesses. Your representation of the National Federation of Independent Businesses has you really plugged in with what's happening in Main Street America, Main Street, Arkansas, what's happening in smaller towns as well as cities in the state. It's been devastating for small business owners, not only from the perspective of its impacted sales and revenue, but it has also impacted workforce. Speak to our listeners, readers, and watchers a little bit as to what you have kind of seen and what you've been struggling with, what your members have been struggling with.
Well, thank you, Roby. And I think, as we all know, small business owners, we are optimists. And NFIB has a tool that we use to track that optimism. It's called the Small Business Optimism Index. And right now, Roby, 2 years into this pandemic, our members are feeling better than they have in the last year and a half. Our optimism index is at about 98%. But some of the things that we see that are concerning trends, there's one question we ask about a business owner's expectation that the next year will be better than the last. And that indicator is the lowest it's been since 2012. And so people are very concerned that this year will be better than last year, especially our small retailers. This entire issue with goods coming into the country, the supply chain nightmare, it really impacts the small retailers about 1,000 times more than large retailers because they simply don't have the buying power. And so I'm hearing a lot of anecdotal stories, especially those retailers that focus on toys, that they had a really down year last year. And that's all compounded with the labor shortage that we're all experiencing. And I think that's driven by a lot of different factors. Number one, rich government benefits. But secondarily, I think this entire 2-year period of people really sensing their mortality has folks reevaluating their lives and their jobs. And so we're all going to have to work together, Roby, come together and be extremely creative and pragmatic to find a way to solve this labor quagmire that's frankly choking economic growth in our nation.
I think all three of y'all, I want to get your take on what Sylvester just said, but Sylvester, staying with you on that, it's called the Great Resignation, where you've seen people leaving their career paths that they've been in for a long period of time, or having this reevaluation as to what they want to do with their lives in terms of their livelihood. What are the conversations around that in terms of how a small business in particular, and Joe, we could talk about that from the public health perspective, and Shannon from your industry's perspective. Tell me how you guys are coming at solving that problem and coming up with ways to have discussions about it that will provide solutions.
Well, internally, there's an internal approach and then there's an external approach. The benefit that small business owners have is that we work side by side with our employees. There very much is that familial type dynamic. And many employees, they appreciate that, they value that, they like being more than just a number on a time card. And so that really is the advantage that we have over our larger compatriots out in the economic landscape. That being said, though, economic development on the grandiose scale is great for our state, but it can be very challenging for small business owners when labor is tight. Like, for example, right now in Central Arkansas, Amazon has come in and created 2,000 high-paying jobs. It's going to be great for our community, great for our tax base, but it creates challenges for small business owners because those employees are coming from somewhere, and 9 times out of 10, they're coming from my members. And so externally, I think just working with policymakers to ensure that we have reasonable, rational, and limited government benefits to continue to pull people out of this pandemic. And I think those are the two approaches that we're focusing on, Roby.
All right, Joe, from a health perspective, and Sylvester kind of articulated it as, people are reevaluating their own mortality. They're reevaluating how they want to spend their lives. Tell me what that Tell me, guys, I guess how you kind of process that, the lens that you look at that through from a public health perspective, and you look at mortality rates. I mean, you understand there's the psychological portion of this.
Well, let me respond in really three different ways. First, for all of us, we've all experienced a worldwide pandemic, which no other generation has experienced, no other group has experienced. It disrupted almost every aspect of our lives, our health, our kids' education, our work, our social fabric, our faith-based activities. I mean, as a population, as a society, we've gone through an enormous amount of stress over the last year and a half to 2 years that we should not be surprised that people are reevaluating, reassessing what's important to them, what do they want to change, what can they change. So I think it is important for us all to take a step back and say we've gone through a hell of a 2 years that affected everybody in lots of different ways, and that we're going to have different reactions to that. With respect to the healthcare industry itself, some recent surveys suggest that as many as 1 in 4 healthcare providers, nurses, pharmacists, physicians are going to reconsider being in the healthcare delivery system within the next 3 to 5 years. That's a major workforce issue that is a threat to us all moving forward. Part of that is because early on, the healthcare industry and workforce responded and were heroes. Later on, we've got this division within our society of those who do believe in science and in medical advances, inclusive of vaccines, and those have either for political or for other reasons, resisted that. And so now we're having waves of healthcare treatment be required that otherwise might have been avoided, and the emotional toil, the physical toil on our healthcare workforce is significant. And finally, you talked about mortality. For the first time ever in a century, the mortality, the life expectancy has dropped by 1 or 2 years because of COVID-19. More than 1 in 100 seniors we've lost in the United States because of COVID-19. We have even greater disproportionate impacts on lower income communities and communities of color. Groups that could not work from home had to go to work to get paid, were more likely to get exposed, and then therefore more likely to get infected. So it's a big impact, COVID as a pandemic. And I think we need to really look at, as we move forward, how we put safeguards in place, because this is potentially not the last threat from a new infectious agent that gets introduced onto the worldwide stage.
I mean, what would a safeguard be that you're talking about, putting safeguards in place?
Well, I really think we need to learn from our experience. You'll remember when COVID first hit the coast, it was mainly in the large, from my vantage point, with the parent COVID-19, we had 3 waves. It hit the large cities on the coast, which had a lot of international travel. As a nation, there was a lot of shutdowns that occurred. Our state took a phased approach, but still we put restrictions in place when the virus really wasn't here yet. Then it started hitting our larger cities, including our state capitals and metropolitan areas. In the third wave, by the time it got to our rural communities, lots of folks really were fatigued and didn't take the warning signs as significantly as they should have. So we need to learn from this experience. Think about the infrastructure that we need. Our health department, just like our roads, have been undervalued and under-resourced to build the infrastructure that we need to keep up with the potential threat of the future. And we also need to accept that science and technology can help safeguard our families, our communities, our economic situation for the future. And we need to think about that in advance before a new threat emerges.
Shannon, your industry was already dealing with workforce issues in large part just because of generational changes and demographic changes. This is certainly, the pandemic has compounded that situation for you all. Give me an assessment of where we are in the trucking industry today and what you see as some potential fixes for the workforce issues that you've got.
Well, as you alluded to, the workforce shortage, driver shortage specifically, has been a headline in the trucking industry for approximately a decade, and if not longer. And so certainly those circumstances were exacerbated as people were, put in a difficult position. Those who were facing retirement or near retirement, or had situations at home that were made more challenging by the pandemic, left the industry at an increasingly high rate compared to the pre-pandemic levels. And so you had, prior to this, mass resignation that you referenced, our industry was seeing people elect to leave the industry earlier, perhaps earlier than they would have otherwise. And then when you compound that with throughout the country, several truck driver training schools, DMVs were closed or had minimized capacity for months, if not greater than a year. And so we weren't having those new entries, new drivers coming into the workforce. You had increase of the complexity of the supply chain. No longer were people going to the pharmacy or going to the grocery store. We're now having those things delivered to our front door, which requires more manpower. And so you've had the industry has kind of morphed a little bit in that we now have to be more than just distribution center to retail store. It's that final mile going not just from the store to your door. And so that's created more jobs. And now you have the necessity of those long haul shipments needing to be made, but they're competing now with those opportunities for people to stay more local or do regional deliveries, which has made that over the road truck driving position extremely difficult to fill.
Well, that's Arkansas Center for Health Improvement CEO, Dr. Joe Thompson, Shannon Newton, president of the Arkansas Trucking Association, and Arkansas director for the National Federation of Independent Businesses, Sylvester Smith, with their takes on what they see happening in the economy at this moment in time and what they see on the horizon. We will hear more from them next week in the show.